She was given an epidural, but the anesthesiologist inserted the catheter incorrectly. He also failed to wait long enough between the test dose and the full anesthetic. Then he gave her more medication, but didn't document it. ShaAsia went into cardiac arrest. Doctors performed an emergency C-section. Her daughter Chloe survived, but after 45 minutes of CPR, ShaAsia was pronounced dead. And an investigation later revealed multiple medical errors. The anesthesiologist lied about the procedure and kept poor notes. He eventually lost his license, but no criminal charges were filed. No hospital system reforms were publicly announced. No one else was held accountable. ShaAsia's death sparked protests and a renewed call for transparency in maternal care. A mural was painted in her honor, a memorial garden was planted, but her family is still grieving a loss that should have never happened. Black women in the U.S. are nearly 3 times more likely to die from pregnancy-related causes than white women, even when education, income, and access are the same. ShaAsia Washington was one of them, and the timing of her death, the day before America celebrated freedom, is a painful reminder. We cannot celebrate liberty while ignoring inequality. We can't claim justice while mothers are dying preventable deaths. Every voice, every story brings us closer to a future where Black mothers are seen, heard, and protected, not remembered only after tragedy. Healing starts with knowing. Follow for more.
Wow. It's worse, worse, and it's getting worse, you guys. Not only did this happen in Indiana, but there was also a case this same past week as well out of Dallas, Texas, where something similar happened to a young lady. She went to the emergency room. Many of you probably saw it on social media. She is crying out in pain. And the lady that's doing the intake, I'm assuming it may be a nurse, is just casually sitting there, name, date of birth, due date, and as her mother is sitting there watching her child in labor suffering, she asked the question, do you treat everybody like this? Or is it just the Black patients that come in for care? Do you treat everybody like this? So, I'm thinking, I'm listening to this, and I'm just wondering, what can we do? Again, I asked that question earlier, Miss Black Hollywood, and I want to revisit that. Is there anything that we can do? Let's go back to Mercedes and her family. Was it something they could have done differently to get a different result? What can we do? Miss Black Hollywood, I throw it to you.
Yeah. What I noticed is that she went to the hospital and she didn't have a doctor. She didn't have an OBGYN. That's something I noticed when I went to get my doctor. I was looking for a Black doctor. That was just, and I didn't find one here in Los Angeles that was in the network and all of that. There just wasn't.